Right now, the U.S. is experiencing a record number of hospitalizations from coronavirus as new government data reveals that more than 1 out of 3 Americans live in an area where hospitals are running critically short of intensive care beds. This, according to the New York Times. Joining me now is an emergency medicine resident physician at UT Health San Antonio, Dr. Owais Durrani. Dr. Durrani, it's great to have you with us. So the data shows that 1 out of 10 Americans across the Midwest, South, and Southwest live in an area where ICU beds are completely full or have fewer than 5% availability. What does this mean for patient care?
Thanks for having me, Eamon. It means it's not good, essentially. So in the emergency department, we are there to see critically ill patients with severe complications from COVID, heart attack, strokes, stabilize them, perform a few life-saving measures, and then get them into the ICUs where they need that close monitoring. They're on numerous medications. They need tight blood pressure control, ventilation changes, many things that are very time consuming. Because the ICUs are full, a lot of those patients end up staying in the emergency department for hours and a lot of times days. And in the emergency department, we have limited physicians, limited nurses, limited respiratory therapists. And so although we take care of those patients when they're down in the emergency department to the best of our ability, that is not a place for them to be when they're that sick. Study after study has shown that the longer a patient is in the emergency department setting that needs to be in an ICU, the poorer the outcomes and the longer the length of stay in the hospital. So it's not a good situation.
Doctor, I got to ask you about the projections and models that we've been seeing, because they all tell the same story, that there is a strain on our hospitals, and it is certainly going to continue in the weeks ahead as we go from the Thanksgiving surge into the Christmas and holiday surge. What is being done now in anticipation for this continued uptick in new cases and hospitalizations?
Well, I think the simple answer is not enough is being done. We are, seeing a record number of cases. We are finally seeing the surge of cases and hospitalizations from Thanksgiving now. The other thing that concerns me is those individuals that did get infected during Thanksgiving are now traveling back or traveled back, and so they might be infecting more individuals. And so we're continuing to see an upwards trend in all of the wrong metrics. For example, here in San Antonio, pre-Thanksgiving, our positivity rate was 9%. That jumped to 15% post-Thanksgiving. And the concerning thing is during the surge in the summer and spring, our local and state governments put in place stricter public health regulations and mitigation efforts. We're simply just not doing that this time around. And so unless we really change how we lead through this pandemic over the next few weeks, we're going to continue on this trend that we're on.
Let me ask you about your hospital for a moment. Can you tell us what you're experiencing at that hospital? Because I'm also curious to get your thoughts about whether or not you have enough supplies of PPE. What, if anything, is missing from that part of the equation?
Yeah, so thankfully we do have enough PPE at our hospital. There are still reports of some hospitals in kind of more remote parts of the country that are still lacking some of those supplies. From the last kind of update I got, we still have enough ventilators and things like that. The problem is during the surge in the spring and summer, we got a lot of physicians and nurses from across the country. So we were having hotspots at various points in the country, and we were able to mobilize staff and resources to areas where that was happening. Now the entire country is a hotspot. And so what worries me is that although we are able to handle the surge so far, if we continue to head on this trajectory, at some point, we're just not going to have enough manpower to take care of these patients. And unfortunately, because the entire country is in a kind of red zone right now, we're not going to really get that help that we got last time.
All right, Dr. Owais Durrani, thank you so much for your time and your effort this afternoon. I appreciate it, sir.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.